The second leading cause of death in our nation is an illness that does not discriminate against anybody. It is cancer. It is an unnerving disease that none of us ever want to hear being diagnosed to ourselves or those that we care for. I can share with you firsthand that it is a frightening experience, as I have had many family members of mine fall ill with cancer. The more knowledgeable that we are on the illness, the better that we can understand the way that it develops, works, and affects our bodies, which can assist us in taking the proper precautions necessary to avoid development. Cancer is a general term, but there are many different types and ways that one can develop the disease. There are factors that increase our chance of development, some of which we can control, and unfortunately, some that we cannot. Studies and medical advances have provided us with different prevention methods or treatments in the case that prevention is unsuccessful. In order to better understand the disease, we must first learn exactly what it is and how it works. According to the textbook Biological Science, cancer is a general term for a disease caused by cells that divide in an uncontrolled fashion, invade nearby tissues, and spread to other sites of the body. Cancer occurs by cancer cells using nutrients and space that is needed by other cells while simultaneously disrupting the function of the surrounding normal tissues. This uncontrolled division of cells often results in a mass of tissue, which is what we all know as a tumor. There are two types of tumors, which are benign and malignant. A benign tumor is one that is not cancerous, and a malignant is one that is cancerous. The Cancer Treatment Centers of America states that although not all tumors are cancerous, there is no such thing as a good tumor. Tumors pose a more serious threat as they are more aggressive, invasive, and tend to spread throughout the body if not removed. Benign tumors are far less of a worry, but still pose a threat due to the fact that they can cause disfigurement, pain, and can disrupt vital structures such as nerves and blood vessels. The National Cancer Institute states that there is over 100 different types of cancers that can develop throughout the body. These cancers are often named after the tissues or organs where they were formed, but may also be named after the type of cell that they were formed by. Body parts such as the ovaries, the breasts, the skin, the brain, blood, bones, the stomach, and even the eyes can develop cancer. According to the Center of Disease Control and Prevention, cancer is able to spread from one part of the body to another through the blood or through the lymph system. With better comprehension of what cancer is and how it functions, I'll now explain a few of the factors that can increase a person's chance of developing it. It is nearly impossible to understand why one person may develop cancer while another does not. But thanks to extensive research and studies, we have discovered factors that assist in increasing a person's risk of developing cancer. There are two different types of factors that can increase chance of development. The first is referred to as being controllable, which means that one can limit their exposure or risks of being exposed to these harmful agents. Controllable risk factors range anywhere from intentional carcinogen exposure to lack of proper diet and nutrition. The American Cancer Society refers to carcinogen exposure as environmental factors that cause changes in cells' DNA, resulting in cancer. The second type of risk factors are those that cannot be avoided or controlled. Genetics and family history are a huge contributor to the unavoidable factors that influence cancer development. An example of this is inherited cancer syndrome. Inherited cancer genes are flawed genes that are passed from parent to offspring. What is inherited is an abnormal gene and not the cancer itself. Cancer Research UK states that once a flawed gene is inherited, the gene is no longer able to repair damaged DNA in cells, and this is when and where the cancer initially begins to form. Another uncontrollable factor that influences the development of cancers are hormones. Estrogen and progesterone, made by a woman's ovaries, has been shown to increase a woman's chance of developing breast cancer. This comes from being exposed to these hormones in excessive amounts or for prolonged periods of time. Excess exposure can come from starting menstruation early on, experiencing menopause late, a first pregnancy at an older age, and never having given birth. Next, I'll discuss a few of the ways that cancer can be prevented and treated. Fortunately for us, there are steps that we can take to assist in preventing the development of cancer. And when that isn't always possible, there are different forms of treatment that are available to us. There are many different ways that we can reduce our chances of falling ill to cancer by use of different prevention methods. First, we can take steps to better protect ourselves from ultraviolet rays. This can be done by completely avoiding the use of tanning beds and by using proper protection when you plan on being out in the sun for prolonged periods of time. Second would be to avoid consumption of alcohol and tobacco. These are two carcinogens that can easily be avoided simply if you choose to. The consumption of alcohol and tobacco could result in mouth, throat, liver, larynx, and lung cancer. Next would be to maintain proper diet, nutrition, and sufficient amounts of exercise. Being overweight increases the chance of developing breast, colon, rectum, pancreatic, and many other cancers. Excess weight also causes the body to produce more estrogen and insulin, which are hormones that are known to stimulate cancer growth. And last but not least is receiving all recommended vaccinations. Some cancers such as liver, cervical, and other genital cancers can be avoided with the administration of the hepatitis B and the HPV vaccines. In the unfortunate case that cancer cannot be prevented, there are many different treatment methods that are offered to patients. The first treatment method is surgery. In this method, the patient undergoes a surgical procedure where a surgeon cuts and opens the body to remove the cancer. The issue that may be encountered here is that sometimes the cancer has already spread throughout different parts of the body, so it can become difficult or nearly impossible to remove at all. The second most common method of treatment is chemotherapy. Chemotherapy is the use of drugs to kill cancer cells. These drugs can be taken orally, through an IV, or through injection. The issue that may arise here is while the drugs are fighting off cancer cells, they're also fighting off healthy cells as well. This is what causes hair loss, fatigue, loss of appetite, and in severe cases, death in chemo patients. The next method is radiation therapy. Radiation therapy is exactly what it's called. It's therapy to kill cancers by the use of radiation. According to Cancer Quest, the disadvantage of radiation therapy is that it may damage the tissue cells that surround the targeted treatment area. The last method, which is referred to as immunotherapy, is one that is not used as often as the previously mentioned ones. This procedure uses specific drugs that strengthen and assist the immune system in fighting off cancer. Immunotherapy is administered orally, through an IV, through a topical cream, or intravesical, which means it is given directly into the bladder through a catheter. After discussing the ins and outs of cancer, we can come to determine that it is a powerful and complex disease. The more educated and informed that we are on the illness, the better that we can understand the way it develops, works, and affects our bodies, which can assist us in taking the proper precautions necessary to avoid developing cancer. I've discussed the way that cancer works and develops, the varying types, the risk factors that we intentionally and unintentionally expose ourselves to, the precautions and preventions that we can take to prevent ourselves, and lastly, the treatments that are available to patients if ever necessary. Cancer is a disease that is affecting our nation in a huge way, with 40% of individuals developing it throughout their lifetime and 1/4 of all deaths being cancer-related. Take the necessary precautions and live a healthier lifestyle. You only have one body and one life, so take the best care of it. Thank you.